Nyt sitten siirrymme tämän päivän kansainväliseen osioon. Olemme saaneet tänne edustajan Genevestä, eli YK:n ihmisoikeuskomissaarin toimistosta, ja hän on Victoria Lee ja ohjelmajohtaja. Now we have a pleasure to have our international guest speaker. She is Miss Victoria Lee. She's a program manager from Office of the United Nations High Commissioner for Human Rights. The floor is yours.
Thank you very much. Good afternoon, everybody. I'm very honored to be here on behalf of the Office of the High Commissioner for Human Rights, and feel very privileged to be here for this very special occasion of the launch of the National Action Plan in Finland. We were all very much looking forward to Finland joining the CRPD family 2 years ago when that happened. And it's great to see that this commitment now is being concretized into an action plan. And we're celebrating actually many things besides the launch of this action plan. It's 70 years anniversary of the Universal Declaration of Human Rights. We're in the 10th year, of course, since the adoption of the convention itself. And it's just over 2 years since the 2030 agenda was adopted. Within all these instruments, we can see that inclusion is the common thread. So I'm going to be talking about how these instruments have enhanced the agenda for inclusion and the need to keep inclusion on top of the agenda at all levels, at the national level, regional, and global levels. I'm using a PowerPoint, and just to let you know, I won't be going into depth into all the slides. There's a lot of information there, and I believe that can be circulated later, so no need to try to keep up with all the text. So before we go into more technical conversation, I just wanted us to reflect on why we are making plans, talking about budgets and strategies and human rights and development, what this means beyond the technical issues. We often get caught up on these technicalities of the ifs and the hows, and we shouldn't get distracted by all that to the point of risking losing sight of what is at the heart of these goals. And simply advancing and improving society through improving the well-being of every member of society. Human rights is about the individual, and true development puts people at the focus. So it's about including all members of society in recognition that inclusive and participatory societies benefit from the skills of all. And when everyone can reach their full potential and enjoy and exercise their human rights and live in dignity, the society as a whole reaps massive economic, political, and social benefits. So while we often refer and talked about the international human rights framework and international development and cooperation, and this may sound high level and abstract, it's actually about each of our lives in the small places on the ground, close to home, to ensure that inclusion and participation in the school, farm, office, throughout our communities. Yet, of course, we face constant challenges to this. There's exclusion and segregation, in particular of persons with disabilities from the rest of society. There's gaps of resources and economic growth within countries and between countries. The traditional division between development and human rights led to greater gaps where economic development was prioritized to the detriment of enjoyment of human rights. So human rights instruments serve as the reminder and bind states to the obligation that we need to surpass these divisions and keep people at the center. So before the convention was adopted, there was no specific instrument looking at the rights of persons with disabilities, which meant that, of course, they were often overlooked and left behind. With the entry into force of the CRPD, there was this paradigm shift, which moved from viewing persons with disabilities as objects of charity or treatment to subjects of rights. And the CRPD is more than a human rights instrument, it's also a development tool. It recognizes all rights for all persons with disabilities everywhere on an equal basis with others. So several of the innovative features of the CRPD figure in your own national action plan, including recognizing the participation of persons with disabilities, living independently and being included in the community. It also embraces diversity and inclusion, so respects the multiple layers and identities of individuals when it comes to gender, age, impairment, type of impairment, whether you have an indigenous background. In particular, I wanted to just put a focus on equal recognition before the law. Recognizes that we all may require some form of support, and this should not restrict us from taking our own decisions. So the convention calls for moving from substituted decision-making to supported decision-making. And this is very much the heart of the convention. And there are, of course, unique tools which the CRPD, which for the first time are incorporated into a human rights instrument. So for example, international cooperation, data collection, national monitoring and implementation, awareness raising, and accessibility. And since the adoption of the CRPD, there has been increased inclusion and references to persons with disabilities in other global instruments. So for example, the Sendai Framework for Disaster Risk Reduction, which requires an all of society engagement and partnership and calls for empowerment of persons with disabilities to publicly lead and promote accessible response, recovery, rehabilitation, and reconstruction approaches. There's the Addis Ababa Action Agenda, which provides a new global framework for aligning all financing flows and policies with economic, social, and environmental priorities. And there are explicit references to persons with disabilities, including relating to inclusive education, accessible technologies, and infrastructures. And then we have the Charter for Inclusion on inclusion of persons with disabilities in humanitarian action. This calls for cooperation and coordination to render humanitarian action inclusive of persons with disabilities. And certainly we have the SDGs, which calls for leaving no one behind and reaching the furthest behind first, which commonly, we're referring not only, but also to persons with disabilities. So for the first time, the global development agenda applies to all countries. Unlike the Millennium Development Goals, which targeted developing countries, the SDGs also applies to developed countries, including Finland and others. And this is in recognition of a collective responsibility that applies to people in all societies, that the right to development belongs to one and all. And in the SDGs, we have specific, explicit references to persons with disabilities. You may know that the MDGs did not have any references to persons with disabilities, and this caused widening of the gap. There was progress for certain groups and in certain areas, but for persons with disabilities, there was not. So now we have the SDGs with specific references, and it's meant to ensure that we all move ahead together. And for the first time, the development agenda has references and is entrenched in human rights. So the SDGs and their commitment to leave no one behind are imperatively inclusive. The SDGs are really a game changer. It's no longer business as usual. The MDGs did acknowledge the link between human rights and development, but they were not adequately aligned with human rights and did not give sufficient attention to discrimination and inequalities. So both the CRPD and SDGs, they have the same objective, the transformation of society to ensure inclusion and participation of all, including persons with disabilities, through upholding their human rights, dignity, eradicating inequalities, combating poverty, ensuring livelihoods, education, health, gender, freedom from violence, access to justice, among others. I wanted to look specifically at some issues arising from the SDGs, which of course are linked to the CRPD. Firstly, poverty, and we know that persons with disabilities are disproportionately impacted by poverty. that they're overrepresented amongst the world's poor, that there are low employment rates and have low salaries. Persons with disabilities are less likely to attend school or to complete schooling, and they're more likely to be excluded from basic social services. And the cost of exclusion is very significant. There have been studies which show that the exclusion of persons with disabilities from the labor market cost quite a sizable amount of national GDPs, and that there's a significant loss and a burden to economies where persons with disabilities are not participating in the labor market. So employment and social protection cut across. There are specific goals related to eradicating poverty and to ensuring employment in the SDGs, as are also in the CRPD. And of course, they touch upon many other goals and rights, such as education, health, equality. So they're all interrelated. Goal 8.5 of the SDGs specifically refers to persons with disabilities in employment, that they receive equal pay for a work of equal value, and they all participate in the labor market. And this is also reflected, of course, in the CRPD under Article 27. And I just have up on the slide some examples of treaty body recommendations concerning employment of persons with disabilities. So from, of course, the CRPD committee, which is calling for access to employment in open, inclusive, and accessible markets and environments, providing reasonable accommodation for persons with disabilities at work. And just looking now at social protection, this is covered by Goal 1 of the SDGs. And we have actually a particular indicator within the SDGs, which refers to persons with disabilities, and in respect to how they are covered by social protection floors. This is the corresponding provision of this in the CRPD is Article 28. So we know that Article 28 is about adequate standard of living and social protection. So adequate standard of living refers to adequate food, clothing, and housing, and to the continuous improvement of living conditions. And right to social protection includes housing programs, social protection programs, poverty reduction programs. We know that persons with disabilities incur extra expenditures, for example, when accessing disability-related goods and services, so mobility aids, devices, assistive technologies, that cost more. But also costs more often for persons with disabilities to access non-disability-related goods and services, which might come at a higher price due to challenges and barriers relating to accessibility. There have been studies which have shown that many disability-related extra costs are directly related to lack of accessibility or inclusion, and they can amount to almost 50% of an individual's income. So when we're thinking about employment and social protection, and of course all other areas, we need to keep in mind what kind of approach we're putting forward to achieve an outcome. And often when we are rearranging or planning our social protection schemes, we might think, well, this is very protective, this will allow many benefits, but we need to think, what is the outcome? If, in fact, for example, with employment, persons with disabilities are receiving benefits, which might have inbuilt disincentives to work, is that really the kind of society that we want to contribute to? Is that the kind of society where persons with disabilities just receiving benefits but cannot, even if they would like to, enter the labor market? Are we assuming that they're unable to work, that they're unable to study, unable to participate in the community? So, of course, all those presumptions and preconceived ideas very much linked to the old model, the charity model and medical approach to persons with disabilities, which resulted in segregation, institutionalization, the lack of decision-making. And this is the approach that we want to move beyond. So when we are looking at the National Action Plan or reforming a law or a policy, we need to keep in mind what is the outcome that will arise from this. Will it increase one's autonomy, increase one's freedom of choice to participate and be included, or will it hinder or threaten their self-determination and their independence? So I know that in Finland there are reforms being undertaken currently or being foreseen with respect to social services, with respect to self-determination, and all these questions need to be asked. What is the approach and what is the outcome that we want? And a very simple way to test this, if we're not sure, when in doubt, we return to the principles of the CRPD, which are under Article 3 of the Convention. And I listed them there. They are respect for dignity and individual autonomy, non-discrimination, participation and inclusion, respect for difference and diversity, accessibility, equality of opportunity, equality between men and women, and respect for the evolving capacities of children with disabilities. So anytime we want to reform a law or draft a new law, repeal a provision perhaps, and we're not sure whether that is compliant with the CRPD, we look back at the principles. So if we have a legislation which is perhaps, or a policy which is promoting employment of persons with disabilities, but only in segregated environments, does that respect the principles or does that contravene the principles? Or if we have legislation in place which continues to hinder the decision-making of persons with disabilities, for example, through guardianship regimes, is that in line with the principles of the Convention? Well, in both these cases, that would hinder one's participation and inclusion, respect for their individual autonomy. It's discriminatory. It does not respect their difference and diversity. It doesn't provide support for difference and diversity. So we need to keep this in mind as we move ahead, as you move ahead, looking at your National Action Plan and beyond through these legal reforms that will be taking place. As we know, all human rights are universal, indivisible, interdependent, and interrelated. So looking at the goals and the targets that have been mentioned and the areas of your National Action Plan, of course, those impact on a whole host of other rights, which may not be explicitly referred to in your National Action Plan. So, for example, restrictions of denial of legal capacity can impact upon the exercise of almost all rights when it comes to signing a work contract or accessing benefits or giving your free and informed consent in the context of health. The impact of institutionalization and forced treatment and detention impacts on whether you have choice and freedom over deciding where you live and with whom you live, how to be included in society. And also looking at the impact of gender-based violence. I realize this is not specifically referred to in your National Action Plan, and obviously that is because it's for a very short term and it's only including some priorities, but that has a big impact on other areas such as health, gender equality, employment, education, etc. So we need to ensure that the SDGs, which provide many, many opportunities, it's an expression of global political commitment, and there's a lot of momentum today and investment to ensure that the SDGs are implemented. We need to ensure that when they are being planned for and implemented, that they have the human rights-based approach and that they are informed and guided by the CRPD. And in the office, in OHCHR, we're actually undertaking a project currently called Bridging the Gap, which has exactly this purpose. So to develop tools to facilitate SDGs implementation guided by the CRPD. We have this great opportunity to ensure that there's more action taken with respect to persons with disabilities, but we don't want to risk losing everything that we've gained already through the convention and through the work of the CRPD committee. So we need to make available these tools so that policymakers can be guided by what the CRPD means when they are making policies and including persons with disabilities. And one of the first tools that we'll be developing are human rights indicators on the convention. Indicators have a growing demand and interest today. They allow us to design and implement evidence-based policies and programs and guide information and data collection in order to track progress of rights. And they also help us to pinpoint where policies fall short and help us to detect discrimination, provided, of course, that they are sufficiently disaggregated. So following our office's methodology on human rights indicators, we are in the process of drafting these indicators for all the rights of the convention. And I've just put up on the slide some examples of indicators. According to our methodology, we have structural, process, and outcome indicators. And basically all that means is structure is about the commitment to human rights. Usually it's about legislations and policies. And some examples, when it comes to employment, may be having legislation enacted that prohibits discrimination, harassment, violence against persons with disabilities, including the denial of reasonable accommodation. It includes ensuring that there are no provisions in legislation which limit access to employment or vocational training related to any type of impairment. In some countries, persons with disabilities are not allowed to become a judge or to practice law or to practice medicine. There should be no provisions in legislation which include impairment-based assessments, such as capacity or fitness to work. Why should these exist when they don't exist for the rest of the population? It's discriminatory. There should be no provisions in legislation which reserve or limit workplaces for persons with disabilities, such as segregated working environments, for example, sheltered workshops. So those are kind of some structural indicators. Some process indicators, and process are really measure the efforts that are being taken to meet those commitments. So for example, there would be an existence of a comprehensive national employment strategy or plan which promotes the employment of persons with disabilities, and those would have specific features to ensure that they are effective and can be monitored and measured. There would need to be technical and financial assistance for employers, employees, trade unions, for example, on the provision of reasonable accommodation in the workplace or making work environments and communications accessible. There would need to be social protection schemes providing benefits for people with disabilities to cover their extra costs that are compatible with employment. And of course, systematic and meaningful consultation process with DPOs on any national employment-related initiative. This is not comprehensive or exhaustive. These are just some of the examples that we have so far. And outcome indicators would be really about measuring the results of those efforts. So percentage of persons with disabilities relative to persons without disabilities in employment, disaggregated by type of employment. Is that public, private, self-employed? How many are unemployed? How many are inactive or employed in the informal sector? Also looking at the relative earnings of persons with disabilities who are employed compared to persons without disabilities. Looking at the percentage of persons with disabilities in sheltered workshops and tracking that over the years. Is that being reduced? Is that staying the same? Is that rising? So by looking at these outcome indicators, we can really tell whether those commitments in the law and policy and those efforts, such as training or awareness raising, if they're actually bearing fruit and persons with disabilities are being increasingly employed. So one other thing I wanted to mention, of course, is the importance of statistics and data collection. Goal 17 of, obviously, Article 31 of the CRPD specifically calls for data disaggregation by disability, and the CRPD committee has consistently made these recommendations to states, and is also calling for the use of the Washington Group short set of questions on disability for census and household surveys. This is also endorsed by Goal 17 of the SDGs, the need for data disaggregation, including by disability. And so just briefly, the Washington Group short set of questions is 6 short questions which can be used to disaggregate any national surveys and census and household surveys to pinpoint how many people with disabilities across all different sectors. It's been tested and widely used in many, many countries. Also in employment, in specific surveys such as employment. So as we approach the 2020 census round, more and more countries are actually committing themselves to use these questions, and it's very important and pivotal at this moment, considering that we need a common baseline to know where persons with disabilities stand today, and to be able to measure that in 10 years and 15 years, at the end of, at 2030, but beyond, to be able to measure whether persons with disabilities are still being left behind, or to what extent they're being left behind, in order to better formulate our policies to address those gaps. And this requires, of course, cooperation amongst all stakeholders when it comes to monitoring and tracking and implementing. Of course, the government and the government disability focal point in particular, the participation of organizations of persons with disabilities, NHRIs, and national statistics offices. And I want to just emphasize the very important key role that NSOs, statistics offices, play. They're the ones collecting the data, disaggregating the data. And really the cooperation that has been made in some countries between NHRIs and NSOs has really borne a lot of fruit. The NHRIs and DPOs are able to inform statistics offices about what information, how information should be collected, how it can be collected in a credible and reliable way, and that data then it can inform policymakers and can really reveal where there are gaps that need to be filled. So we know very well that if you are not counted, you do not count. So we cannot continue to remain invisible, or else nothing will be done. There'll be no budget allocated. We need to be counted in order for the resources to be put there, in order to be consulted, in order for our voices to be heard, and policies and laws to be transformed correspondingly. And just an example, when data is collected, I mean, this is a very obscure graph I have up here, but it shows across several countries, about 30 countries, the rates of employment, the rates of proportion of population not in education or employment over many years. And this has been disaggregated by female with disabilities, male with disabilities, female without disabilities, and male without disabilities. And we can see practically across the board that women with disabilities are amongst the group that are not in education or employment. So having this information, it really calls governments to take action. Without it, we can just speculate. Of course, we might know very strongly that there would be such a gap, that there would be such a disparity. But having the information really, holds the government more to account, to respond, and then to be able to track that, so that, and by DPOs, by NHRIs, by others, in order to track the response and the change over the years, whether the situation is improving or not. So just to conclude, we have all these instruments, and I think we can see the progress that's been made since CRPD has been adopted. And every time I go to a country or meet DPOs or people coming from the national level, they know that we work across many countries and we have access to many different stakeholders. And one of the questions I most often hear is, well, how are we going? How are the rights with disabilities going today across the world? Very difficult question to answer, but broadly speaking, we can see, we always know that there's work to be done. There will always be work to be done when it comes to human rights. But just looking back over the last 10 years, there has been a lot of progress. We can see more references and mainstreaming of the rights of persons with disabilities, which is very positive, and high levels of commitment. But all of these high levels of commitment, of course, require data, indicators, measurement, for the purposes of accountability and effectiveness. And we need to be reminded that all of this exercise, these undertakings, it's about each and every person, individual member of society. In Finland, in Helsinki, and other cities and towns in Finland, across the world, it's about ensuring membership and belonging in the community, and not being included as a standard, as a member of society, as a certain norm, but as we are as individuals in all our diversity. I just wanted to finish with a quote from the Special Rapporteur on the Rights of Persons with Disabilities. And she said, imagine a world where we embrace human diversity. We remove the barriers in society and institutions that create discrimination and inequality. We go past the fear and preconceptions that have historically resulted in so much exclusion. We see disability as part of human diversity, like any other difference. And we see the contributions that persons with disabilities can make in all areas of society. We need no longer imagine today. Today we are called to act by the CRPD, by the SDGs, by the National Action Plan, to actively foster inclusion through inclusive development in order to create inclusive communities. And by doing so, to contribute to advancing the rights of everyone and the sustainable development of all. Thank you very much.
Thank you very much. If you mind staying there for a little bit. You can hear me? Okay. Thank you very much for this very inspiring and interesting presentation that you gave us. I think we have room for one or two questions if you have some to present. Eikö kuulu? Yritän pistää vähän lähemmäksi. Eli nyt jos on kysymyksiä, niin voi esittää suomeksi tai englanniksi, muutamalle on aikaa. So please, if you have questions to Victoria, now you can make them. Just raise your hand and tell who you are and make the questions.
Eli minunko vuoro? Okei. Hyvää päivää kaikille. Nimeni on Tiina Jaakola. Olen vammaisten, nuorten ja lasten tukisäätiöstä. Ja mietin sitä, että YK:n ihmisoikeussopimuksen ensimmäinen artikla puhuu siitä täysmääräisestä osallistumisesta. Täysimääräisestä, full effectively. Mikä indikaattori on? Voisinko siihen saada jotakin viitteitä?
The convention speaks about the full participations of persons with disabilities and especially the young persons with disabilities. What is the indicator for that? The indicator for this, right?
So we're in the process of developing the indicators. We don't have indicators on everything yet. It's not even publicly out. It's being drafted currently. So, but when we come to participation and consultation, that cuts across all rights, and it would of course included in Article 4, Paragraph 3. about active involvement and consultation of persons with disabilities comes under Article 33, Paragraph 3, when we talk about the national monitoring of the CRPD. But we have to cut across all rights when it comes to policies, practices, laws about violence, reducing violence or preventing violence, political participation, health. There would be an indicator included which ensures that in all of the development, in all discussions regarding the issues, that there's meaningful participation and consultation with persons with disabilities, and that, of course, this implicit in that is that it's with a diversified range of persons with disabilities, and not just, it covers all different impairment groups, including those most marginalized. So I don't have an example of the specific indicator yet, but there will definitely be a cutting across all rights.
Thank you. Any other questions? If not from the audience, I would like to ask, since you have this international point of view to the disability issues, the CRPD, how do you see the role of the action programs, national action programs, ones like we are launching today? What kind of instrument they are in national policies, in your opinion?
Yeah, often we see when CRPD is being implemented on the ground, states may create national action plans, as Finland has done, for varying periods of time, as a kind of blueprint about the action that they are going to take to implement the different provisions. And they might cover all sectors and be very specific to persons with disabilities. Often that's the case, but we also want to see those actions mainstreamed into other national action plans, whether it comes to women or employment or children or violence. Every national action plan needs to take into account persons with disabilities, women, children with disabilities, etc. It's not enough that there's just one national action plan or program. It really needs to cut across all, because the rights of persons with disabilities cuts across all issues and all themes and sectors. I think what's important is not only to have that plan, and of course that they have the plan and that it's compliant with the CRPD, that it doesn't erode the standards of the CRPD or go against any of the provisions. And to test that, go back to Article 3, go back to the principles of the convention, but also that it's operative, that there is a way to measure the progress that's been taken, whether that's by having benchmarks and indicators, different monitoring mechanisms. There has to be monitoring and evaluation, and that needs to include, of course, persons with disabilities, of course, in its conception, in its design, in its implementation, and then in its monitoring. So, it's not enough just to have a pretty piece of paper. It needs to be able to be tracked and held. The government needs to be held accountable by that.
Thank you. Any other questions? Okay, thank you very much, Victoria. We're very happy to have you here today.